Hello there. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. And I have with me today Dr. Twinkle Singh.
Hello.
Hi, Dr. Singh. Dr.
Hello.
Singh is not a newbie to Facebook Live. She's been on several times, so if you enjoy this broadcast, you can probably search and find her on other broadcasts that we've done about things related to heart health. Today, what we wanted to do was to actually show you around our cardiac cath lab, which is where Dr. Singh and her team does a lot of their work.
Yes.
So I am going to give the floor to you, Dr. Singh, I'll take that back. Before we kind of talk about all the bells and whistles here, can you just in a nutshell talk about the different types of procedures that you're able to do for patients in this room?
Cardiac cath lab essentially is the place where patients, when they come with a heart attack, which essentially is the blocked artery of the heart, or the arteries of your legs when they get blocked and people develop wounds, or the arteries that supply blood to your brain and the arteries that supply blood to your arm, if they develop blockages in them. This is the place where we can open those blockages. Okay, essentially the way that's done is we enter your body either from the artery in your wrist or from your artery in your groin, go with catheters and wires and put a wire through a blockage, open it up with a balloon, and usually put a stent. Yes, so when the patients are here, this is the table where they lie flat. That's your camera that captures the pictures, and that's the X-ray equipment where the X-ray beams come from.
Okay.
And yes.
So if I'm a patient, I'm going to be, my head is going to be up
your head
here.
Is there.
My arm's going to be.
Your arm is there.
Okay, all right.
Yes.
And then I understand that you stand on this side of the table,
Stand
actually.
on this side. That's the console that we control the table and the C-arm with.
Okay,
Yeah.
and then behind you.
Yeah, so whenever we take pictures of your heart, since you're going to be here, that picture is transmitted here and we can visualize what's happening with your heart arteries.
Okay.
Yeah.
Yeah, and I think the technology in this room is the latest and greatest. I mean, they've
Yes.
been continually upgraded in
Yes.
terms of what we have in here.
Yeah.
Okay.
So we can do very complex procedures as well. You know, there are certain times when the blockages can be either simple to deal with or they can be very complex, dealing with calcium. We do have a lot more equipment now than before to deal with those complex blockages.
Yeah.
We have specialty balloons, we have our atherectomy devices, we have our cutting balloons. So we do have much more newer and advanced technology available to us.
Yeah.
And in patients who are very sick, we do have certain devices that can support your heart through the procedure. Yep.
Yeah, and so I don't know if we have it in the room here, but if I remember right, you also have ultrasound that you can
Yes.
use for patients. You want to talk about that
Yeah.
and how that works?
So when we say that we enter your body, essentially what that means is we're putting like an IV line in your artery. And the way we visualize that artery and stick it with a needle is under ultrasound. So let's say if I need to enter my radial artery here, we numb the area with the local anesthetic. Then I put the ultrasound on your wrist and I can visualize how your radial artery is on the ultrasound, and under ultrasound guidance we put a needle in the artery, and through that we put in like a sheath is what we call it in your radial artery. It's like a tube, and through that we can go and access your artery and your circulatory system with catheter. So we go with a catheter all the way where your heart is, and we put that catheter where your heart arteries are coming from. And heart arteries are essentially the pipes that lie on the surface of your heart. So if this is your heart, and this is the heart muscle, the arteries lie on the surface of it. Okay, so that is what we're trying to open. So we access that with the catheter. We shoot a dye, a contrast that we can visualize on the camera, and we can see how that contrast is filling on this monitor. So depending on how the blockages are, we can put a wire through that, and then so on and so forth, and open them. So the purpose of the ultrasound mainly is to visualize the arteries to access them. So that reduces the risk of complication tremendously, because we are not sticking you multiple times, by guessing it. We are seeing exactly where we are going. So yeah.
And then in terms of, so you're talking about for sure folks who come in who are having a heart attack. my understanding is you also have patients that have come in who maybe have some heart symptoms, but they're not actively having a heart attack.
Right. So blockages can be either stable, they can have, people can develop very tight blockages over time, which don't necessarily may not give you a heart attack, but they can give you a lot of chest pain. So that's like what we call stable angina. And if somebody's symptoms are so lifestyle limiting that, they cannot, sometimes patients cannot do anything because of the chest pain. So that's one reason to open up those blockages. And then yes, the heart attacks, which heart attack is an acute blocked artery, and suddenly it cuts off the blood supply to a part of your heart muscle.
One other thing I just wanted to cover is that this is a cath lab, so really sick people are in here, and sometimes things don't go the way that we would like them to in terms of the patients, and they sometimes will have their heart stop while they're having this done. Can you talk a little bit about what's in place to try to help them, help you and help the patient out during those situations?
I mean, unfortunately, that's the worst thing that can happen to anyone, and it does happen. This is the room for sickest of the sick people. So, but if this were to happen to somebody, this is probably the best place to be, because we do have equipment right here. We have our code card like right in the room. So we have medications and everything that we can give to bring the heart back. And when you're on the table, we have the pads on you, so we can suddenly, as soon as your heart goes out of rhythm into a dangerous arrhythmia, we can shock you back into the normal rhythm.
And I think I wanted to make sure that folks heard this from you too. How available is this cath lab?
24/7, yeah. We have the cath lab availability 24/7. I'm one of the interventional cardiologists. I have 2 more partners. So one of us is on call every day and day and night. So yeah.
Yeah. And I also wanted you just to kind of, if you would, share too about the rest of the team that's around you that helps out with this and kind of their level of expertise, if you would.
We have an excellent team. I mean, that's like the best asset of this cath lab. We have like excellent techs and the nurses. So your nurses take care of you when you initially come to the hospital. Let's say for an outpatient procedure, for an outpatient elective, you will be seen by the nurses. They'll take care of you in our holding area, which is outside the lab, and then they bring you to the room. In the room, we will have. So if I'm doing the procedure, I have one more technician with me that assists me, and then you have one more nurse in the room that administers medications, keeps an eye on you, make sure you're not having any pain, and or you may not need anything. Sometimes you are awake during the procedure, sometimes you're sleeping, depend on the type of the procedure. And then you have another person outside the lab that monitors everything.
Yeah. So you, if you're watching this, you can't necessarily see this. I think Bran may show this afterward, but there actually is a control room that we are looking at that has a lot of monitors. How do those interact with what you're doing here, those monitors?
So the monitors, whatever we are seeing here, your blood pressure, heart rate, and everything, that can be visualized out there as well. Okay, and the person sitting outside, they document everything what we are using, like every single piece of the equipment, every single piece of the wire, balloons, everything, they document that.
Yeah.
Yes, and if we need an extra help, that they are there.
Okay.
Yeah.
And you mentioned all the things that we use for the procedure. And once again, you're gonna see this as we show the video. We're looking at right over here a whole wall full of equipment that you have available to help patients out, to open up their arteries. Just, it's a lot of stuff, and it's very specific, and I'm sure Dr. Singh obviously knows every inch of it, but for those of you who are watching, what I want you to understand is that there's a lot of resources available for you as a patient, for Dr. Singh and the rest of the cardiologists and her team to help take care of you and get your blood vessels opened up.
Yes. Yeah, we have myriad of catheters here that we use, the ones that I mentioned that we go in your body with. Then we have our wires, balloons, our stents on that side. Okay, these are the monitors where your nurse works from and documents whatever medications we are administering. We have our Impella, balloon Impella is one of the heart pumps that we sometimes use for complex procedures to support your heart through the procedure, or in case if you're having a severe heart failure. So that's the pump right there, and then so we have pretty much all the equipment that's needed.
I wanted to go a little more detail about that Impella. So one more time, explain for folks who are watching what
Yeah.
that is able to do and for what patients it's really helpful.
Yes, it might be easier to show it.
Okay.
Like a picture.
Okay.
Because so Impella it's a pump. Part of it lies inside the heart. It has a motor, and part of it is outside the heart into the aorta. Aorta is the biggest vessel in your body. So your heart pumps the blood through the aorta to rest of the body. So part of the pump is inside the heart and part of it is in the aorta. So what the pump does is essentially it takes over the function of the heart, some part of it. So main function of the heart is the pump. So it just pumps blood to the body.
Yep.
Okay. So what this Impella is that it sucks the blood from the heart and it throws it into the aorta.
Yeah.
Okay. So it takes over and supports the heart through when you're having a heart attack or when you're in severe heart failure.
Somewhere or another,
So-
your heart muscle's not pumping the way it should.
Correct.
Yeah,
Correct. When during a heart failure or when during a severe heart attack, if your heart muscle is very weak and the heart is not able to pump, so to help you get through that bump is when the pump comes into play.
Yeah.
Yeah. So
Very
we
good.
use it in either for very complex procedures, or if somebody comes in with what we call cardiogenic shock, where your heart is just so weak that it's not supplying, like it's supplying very minimal blood to the body, and patients usually don't survive the cardiogenic shock. The mortality rate is more than 50%. So the acting early is what matters in the shock, and thankfully, fortunately, we do have the
Yeah.
equipment and the technology to do that.
The other thing I wanted to take the time just to make sure folks understood is, in addition to opening up blood vessels, there are some other procedures that here just in this room
Yes.
that our cardiology team is able to do.
Yes.
Can you speak to
Yes.
that too, Dr. Singh?
Yes, of course, yeah. So when we're talking about the blockages, part of it and opening blockages, essentially we're talking about the plumbing of the body and the plumbing of the heart. Now you do have certain issues with the electrical system of your heart. Like sometimes patients when they come with a heart block and that the heart is just like not creating its own electrical impulses to beat, and then you need a pacemaker, so we can do that here. Pacemakers, defibrillators, that can be done here, and temporary pacemakers can be done in the room. And which is much newer to us, is ablations for certain arrhythmias. Like there are certain life-threatening arrhythmias like ventricular tachycardia, atrial fibrillation, atrial flutter, or PVCs. All those can be taken care of here. Essentially, ablation, what it means is that we go from the groin through a vein all the way to your heart, and we study the electrical system of the heart, what we call mapping, and then we figure it out where that abnormal heart rhythm or malignant arrhythmia is coming from, and essentially burn the part of that heart muscle, burn and freeze. There are different types. So yeah, so that can be achieved here as well. Yep. And that is done by the electrophysiologists,
Yeah.
which is a specialty of cardiology. Yep.
And one other thing I wanted to make sure we highlighted, you also do work in people's legs.
Yes.
Talk about that if you would.
Yes. So the same way we open the arteries of the heart, the pretty similar principles, we can open the arteries in the blockages. So patients, when they develop plaque or blockages in the blood vessels that supply blood to your legs, and sometimes especially the diabetics patients, they develop foot ulcers, and if you don't have enough circulation to your feet, those ulcers are not going to heal. So patients ended up losing their legs. So we do have technology now that we can open up and improve the blood flow to the feet with catheters and the balloons right here in this room. Yeah, so we can open those with balloons, and sometimes you have to use a stents. Then yes.
Yeah. Thanks. And I know that you work closely with Dr. King, who's our
Yes.
vascular surgeon.
Yes.
In terms
yeah,
of
we
like,
work very closely. Sometimes if somebody's not a candidate for a stent and they need a bypass, then Dr. King takes care of that.
Yeah.
Yes.
Yeah. Anything else that you can think of that we would want to highlight in terms of work that gets done in the cath lab that I'm not thinking of, Dr. Singh?
I think we covered a lot of it.
Okay.
Yeah. So this mainly our interventional procedures and our EP procedures that we do. Sometimes we open up the arteries that supply blood to your arms, what we call subclavian artery stenosis, so that can be achieved here as well. And yes, so the arteries that supply blood to your kidney, called renal arteries, in some certain patients who have very high blood pressure that we cannot control with medications, then sometimes that need a stent in the renal artery, so that can be achieved here as well.
Yeah,
So,
good,
yeah.
good.
Yep.
I'm sure there's more that we're not thinking of, but
Yeah.
I think we've hit the big stuff.
Yeah.
And I hope you get a sense that there is a lot going on in here for when that time comes, and I hope it doesn't, but if it does,
Yeah.
you're in good hands with Dr. Singh. with Chico, who's our manager over this department, and the rest of the team, and Dr. Sherris and Dr. Kiso in terms of helping you out.
Yes.
So Dr. Singh, thank you for taking the time to hang out here and answer a few questions and show this around. So it's a fun thing to show off.
Yes, yeah, absolutely.
All right, appreciate you. Thank you.
Thank you.